begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture is My Life. Now in this episode, I'd like to discuss an interesting topic of which I was engaged in a long chat session about. Now, and that's rheumatoid arthritis and the common cold. Now, for those who are interested in engaging in private chat sessions regarding acupuncture and any ailment you or a loved one may be faced with, simply go to the Google Play Store and download the Acupuncture is My Life app. Now, back to the subject at hand. Now, I'd had an interesting conversation with someone regarding their susceptibility to catching a cold headed into cold and flu season while in the midst of this pandemic. Now, she's recently been diagnosed with rheumatoid arthritis and had heard she's at a greater risk of catching colds, influenza, possibly COVID-19, and so forth. I'd informed her that in my professional opinion, catching a cold is not good if you have rheumatoid arthritis because RA is an inflammatory condition which is much more prevalent in women, and it nearly doubles your risk of getting sick. Because it compromises your immune system by lowering your white blood cell count, i.e., your body has less protection against infectious diseases ranging from, let's say, the common cold to bacterial illnesses. So if you've been diagnosed with rheumatoid arthritis, you have to be extra diligent to prevent infection. I recommend to individuals with RA to stay in touch with their primary care physician as well as their acupuncturist during cold and flu season, especially during this pandemic. Now, some suggestions I've given her along with seeing an acupuncturist are to remain active, although physical activity can be difficult in having rheumatoid arthritis. Exercise is important, so if you have to, try and exercise as much as possible. And try to get plenty of rest. If you can average, let's say, 7 to 8 hours of sleep each night, that would be great. As well as avoid smoking and cut down on drinking. Stop drinking altogether if you can. Now, of course, I was asked if I'd ever treated anyone with acupuncture during cold season that has RA, and yes, I have. Now, when it comes to Chinese medicine, invasion of external wind, cold, and dampness are triggering factors of rheumatoid arthritis. From a Chinese medicine perspective, factors that are involved in rheumatoid arthritis tend to be dampness, which is represented by swollen joints, a feeling of heaviness, numbness, and aching of the limbs. Then there's heat, which is represented by joints that are red or feel hot to the touch. There's also phlegm, which is represented by swelling and bone deformities. And there's also blood stasis, which is indicated by an intense pain that is usually worse at night. There's also liver and kidney deficiency, which is represented by the destruction of cartilage. So when an individual is affected by wind as a pathogenic factor, the pain can move from joint to joint. And when cold is involved, let's say wind cold, which is has similar symptomology as common cold in Western medicine, the pain tends to be in one joint and it can be very intense. Then there's dampness, as I stated earlier, which would present as swelling of the joints. Now, I've treated quite a few individuals who were diagnosed with rheumatoid arthritis, and my general treatment objective would be basically to expel wind, resolve any dampness, and scatter cold based on its manifestation. I would also look to resolve phlegm, invigorate blood, clear heat, and clear out any toxins and nourish the liver and kidneys and tonify the original qi, which is important to boost your immune system. Now, I had a rheumatoid arthritis case this year, several of them, in which I diagnosed as wind cold dampness, where this patient had presented with swelling and pain of the joints, which was aggravated like when she was exposed to cold temperatures. But in this case, the patient's joints were not hot to the touch. Her tongue appeared with a sticky white coating. So I knew in her case I had to expel the pathogenic wind, scatter the cold, resolve any dampness, and remove any obstruction from the channels. So I needle points on the Sanjiao and the gallbladder channels to expel the wind. I needle points on the conception vessel and spleen channel to move the qi and resolve any form of dampness, as well as needling points on the bladder and again the gallbladder channel to benefit the bones as well as the sinews. To this day, I still treat this patient, who of course greatly benefits from her acupuncture treatments, along with the care in which she receives from her rheumatologist. Now, if you have any questions regarding rheumatoid arthritis and acupuncture, just simply go to the Google Play Store and download the Acupuncture is My Life app to engage in private chat sessions regarding this topic. Now, don't forget to subscribe to this channel, as well as go to acupunctureismylife.com and click on Understanding Acupuncture to learn more about acupuncture. And until next time, acupuncture is my life. What's yours?